Behavioral and social science research is playing an increasingly larger role in health-related outcomes at the population and individual levels, underscoring the impact of behavioral and social influences on the nation's health. As technological developments fuel new applications, measurements, and data types, health researchers are even more poised to incorporate social and behavioral science research findings into their studies. The Office of Behavioral and Social Sciences Research, OBSSR, developed its Strategic Plan 2017 to 2021 with these opportunities and their inherent challenges in mind. The office will facilitate the integration and continuous communication between basic and applied behavioral and social sciences, encourage adoption of behavioral and social science findings into health research and practice, and enable development of technological resources for behavioral and social science research. New and innovative approaches to change behavior and social systems to improve health rely on fundamental research that characterizes novel mechanisms and targets. OBSSR works to identify and encourage basic behavioral and social sciences research to develop viable pathways that improve individual and population health. To do so, the OBSSR continues to work with the NIH Institutes and Centers to identify promising and emerging lines of bBSSR relevant to the mission of the NIH, stimulate new areas of bBSSR that address important research questions, and facilitate the translation of bBSSR findings to applied research. Basic research aims to understand nature and its laws. Other terms for basic research include foundational or functional research. Like a tree's roots and trunk, basic research findings in behavioral and social sciences increase our understanding of the fundamental mechanisms and patterns that inform individual and group behaviors. Basic research also strives to explain how these mechanisms and patterns interact with each other, with biological processes, as well as built, natural, and social environments. Applied or clinical research strives to address and resolve practical health issues like preventing alcoholism or obesity, or helping people with chronic diseases live the healthiest, most active lives possible. Applied research focuses on specific health outcomes and the development of interventions for evidence-based practices. To increase the efficacy of clinical research, OBSSR's strategic plan fosters the translation of basic research findings into the design of applied projects in areas such as stress and resilience, social learning, self-regulation, decision-making, executive control, and social influences on health and disease. Health research is most effective when basic and applied research nourish each other. Improved understanding of influential bBSSR mechanisms is critical to informing clinical and translational studies that can help improve health and well-being. OBSSR can encourage and support bBSSR that lays the foundation needed to develop new approaches to change behavior and social systems to improve health. Conceptual models of intervention development have been improved by encouraging a theoretical basis for these models. Extending the basis for these intervention models to include basic behavioral and social research findings has the potential to identify new mechanisms and produce innovative strategies targeting these mechanisms to facilitate change in social and behavioral processes that influence health. OBSSR participates in the NIH Common Fund's Science of Behavior Change (SOBC) initiative, which promotes basic and translational research on the initiation, personalization, and maintenance of healthier human behaviors. This basic research helps scientists develop more effective and economical behavioral interventions to address unhealthy behaviors such as smoking, drinking, and drug abuse, as well as inactivity and poor diet. All NIH Institutes and Centers, ICs, collectively fund and manage the Basic Behavioral and Social Science Opportunity Network, OPNET, to strengthen basic behavioral and social science research, bBSSR, at the NIH in a collaborative manner. As part of its mission to coordinate behavioral and social sciences research across NIH, OBSSR facilitates OPNET to ensure that basic researchers focus on areas of science that show the greatest promise for health improvement but are outside the scope of any individual institute or center. OBSSR encourages promising basic BSSR by identifying scientific needs or gaps, promoting areas of shared interest across NIH institutes and centers, and coordinating closely with other agencies. During the next 5 years, OBSSR will continue to facilitate, support, and emphasize the synergy in basic and applied BSSR.